Welcome. This is Larry Belt. The purpose of this video is to train people that are shopping for a Medicare Advantage plan. And the training will focus on how the various Advantage plans will cover your medications. So that's always helpful. It's always an important criteria when choosing a Medicare Advantage plan. And the first step is to go to Medicare.gov. This is where we're at right now, Medicare.gov. Pretty simple. When you get there, you want to click on this. Very simple again. Find health plans and drug plans. So I'll click there. And we're actually looking for a health plan with built-in drug coverage. So I'll put a zip code in there. You can put your own zip code in, obviously, because these plans vary by county. So make sure you put the county that Medicare has a record of you living in. If you live in another state part-time, use the county where Medicare has that record. And at this point, we are going to get right into the heart of it, and the easiest way to do that is click I don't know, and yes, I want to add drugs. So 2 no's and a yes will get us where we need to be most quickly. All right, now we have the opportunity to add our medications, list of medications. There's no one right plan for everybody based on drugs. Some plans will cover your drug cheaper than others, and vice versa. Pay attention to this here, because soon you will get information that will allow you to log in again. You'll have a code number and so forth, and that'll allow you to go back in and look at this again. But what we're going to do right now is start adding medications, and I'm going to start with an expensive one, Humalog, which is an insulin. And you'll notice that they try to help you decide here by giving you things that have a similar spelling. And with an insulin, this would be the vial, the one that's grayed out right now. These others, for the most part, are the pens, and there's 4 different names of pens, so make sure you have the right pen name. You want the exact one, obviously, so you get the right results. So most people are using the pens now. It's only those brave folks that are still using the vials. And so we're going to select in a package of 5, because that's what most people use per month. They're not going to ask for your units per day. They're just going to ask for how many pens per month, and this is the default. So pick this, and if you need more, you would just have to get another order of 5 during the course of the month, and your doctor's prescription will allow you to do that. So I like to use a 30-day analysis to start with. So also use the retail. We'll be able to use the mail order. We'll be able to see the mail order when we're all said and done. So we want to pick 30-day supplies and retail for now. Okay. We're going to continue to add medications here, and now you notice your drug ID has popped up, your password date. What I would do is select this, copy it, and store it somewhere, or write it down, obviously. Let's try another medication. Lipitor. I'm purposely choosing a medication that has a cheaper generic here. So Lipitor does. And I'm going to pick the dosage that I use for myself, and we want a quantity of 30 that's 1 a day. Don't pick 90 at this point. It'll just make things a little harder to look at. Okay, what happens anytime there's a cheaper generic, this is going to pop up, tell you to give you the opportunity to use the generic. If you don't use the generic, basically they're not going to cover the non-generic. Okay. There are exceptions to this. You'll have to get a plan and then apply to use the non-generic though first. So add some more medications here. Basically what I'm trying to do is get a look at some cheaper meds and some more expensive meds. So we're going to change that just for fun. And again, we're keeping the retail pharmacy in here. The reason being it often isn't cheaper to mail order anymore because the pharmacies have made arrangements with the drug carriers to get you in the store. That they want you in the store, and that allows you to get the cheapest copays, really, by going to the store in most cases. So we'll add this medication for acid reflux. And lastly, I'm going to add a medication called Flonase. It's a common allergy medication, very common. A lot of people have prescriptions for this, but what we're finding is I type this in, nothing pops up. Well, the reason is that if this medication is now offered over the counter, if it's offered over the counter, Medicare is not going to cover it in their formulary. So we can just get rid of that and know that we got to buy it over the counter. Okay. So at this point, you've recorded this information here, and you can now see a list of your medications. Check, make sure it's right. If you do need to delete it or add a different one or change the dose, that can all be done right here. But we're going to assume we did a good job and we've got the right stuff in there, and we're going to move on and see what they come up with. Now, most plans have preferred pharmacies now. They'll have 100 pharmacies that are in the network, but they've got maybe 30 or 25 that are preferred. Okay, so I always open this up. I want the greatest look at pharmacies. And one thing I would tell you to do in Michigan is select CVS. Doesn't mean you have to go there, and select probably Myers. And you can always then back up and see if your local guy is in there. But this will give you the best look at cost effectiveness. So I'm looking at Myers. I don't have a Myers close by to me. So I'm going to search by pharmacy name because I don't have Myers within 4 miles. But people like their Myers. And I'm going to find out where there is a Myers in the area. I know there's one in Commerce Township. And I'm going to get that zip code here. 48390, okay. So now I know that if I enter, I've done this in the past, 48390 and Meyer, it'll allow me to look for a Meyer. There it is. So now I'll add the Meyer. I've got the CVS and the Meyer. I'm in good shape to get a look at the most cost-effective plans. And what we're going to find out here, number one is we're going to check this. But what we're going to find out is when we get this list of most cost-effective to least cost-effective, that some of the plans with smaller networks that your doctors may well not be in are going to come up as most cost-effective. I'm not a big fan of Medicare Advantage plans with limited networks because what will happen is somebody will say, well, my doctor's in this plan even though it has a limited network, so I'm good to go. Well, what if something pops up and you need wide choices of doctors, something serious? So keep that in mind. But it's your decision ultimately, and I can help you look at which doctors participate in which plans when you start to hone in. Okay. In this case, we have number one came up with a plan that is very widely accepted. 97% of all doctors participate in this. Now, number two, in terms of cost effectiveness, is Blue Care Network. That's a name we've all heard of for the most part. If we're Michigan residents, it's a division of Blue Cross. But this is a HMO. It's a limited network. So let's take a look here now at how our drugs are covered with the most cost-effective plan. You can see you are saving a little bit with the mail order, okay? Not always the case, not always huge savings. Now, basically what this column is showing you is what your costs are going to be till the end of the year. So this person is 90 days, and right now I'm doing this in September, so this would include October, November, and December. Normally you folks will be looking after October 1st as you're shopping for next year. We're looking at 2018 information now. 2019 won't be available till October 1. After October 1, it will default as you enter this application here to 2019 shopping, but you'll see an option to go back for 2018, and those of you that are looking for a plan for November or December at that point. So we get a different look here. The costs aren't high because it's through the end of the year, and we're into September now. But basically, we're getting a list of all the different plans. I want to view them all, so I'll go up here and do that. And we're seeing an observation of cost effectiveness based on drugs, okay? This plan is a zero premium plan, very popular. I've enrolled a lot of people in it. It doesn't cost anything. So this is your premium for the plan, but this is your cost for your medications over here. And again, it continues to list, and you'll see it pops up quite a bit as you get into the fourth plan. Now, what I want you to remember too is that this information here also includes what they consider the cost for the drug plan. So it has a premium of $18, but they might say 9 of that is attributed to the drug coverage and 9 for the medical coverage. Okay. Again, another plan, BCN plan with a smaller network. Again, another one. The priority value is all the same network with very vast coverage. Now, this is Blue Cross's HMO that has a widely accepted network, but I can advise you on this stuff if you find something you like. So let's open this up here and see how the medications are actually covered. If you go retail, you can generally order a 90-day supply. Just make sure you've got the prescription for that. So we're going to look over here and look at our drug costs. That's what we're shopping for right now. We see the plan for the drug portion of it has a zero premium. This has a zero premium, and it has an annual drug deductible of $150, which means your costs could be higher in the first month or two than the rest of the year. On this plan here, you're going to see that the costs are always going to be the same for the rest of the month. And for these medications, because they're all Tier 1 and Tier 2, you're not having to meet the deductible. The deductible really is for Tier 3 and above on this particular plan. And what we're finding is Myers is a little cheaper. It's preferred. You'll see that's preferred there. This is standard, okay? So Myers is the place to go with this plan. So $30 per month is going to be your copays. What this means is what your copays are as you're meeting the deductible. Once the deductible is met, this would be the column, okay? Now, this isn't cheaper because these medications don't apply to the deductible. So I want to look at mail order for you while we're here. And we're going to find that $77 for a 3-month supply versus $30. You're saving a little bit, okay? So if you like the convenience of mail order, when you get your packet from the plan you've enrolled in, it'll show you how to sign up for the mail order. Now, at this point, we can go down here and we can see if any of these medications require prior authorization, if they have quantity limits or step therapy. Usually you won't see these two columns as being a problem. Quantity limits are if a doctor's prescribing over what is normally recommended for that medication. So this is rarely an issue here because the doctors usually wouldn't know what they're doing. Step therapy is if they want you to try a cheaper medication first. Prior authorization, is not occurring on these medications, but if it does, you basically just got to get prior authorization. Your doctor will know how to address your drug plan in terms of requesting that. So, and down here is again where we can change your dose, we can add medications or remove. But the important thing at this point is that you've saved this info here. This will get you back into this to reshop, and it'll save it forever. And you can just use this year after year. You know, your medications will change a little bit maybe next year, so that's where you come in and subtract and add so forth. So I'm going to show you right now is we're going to log out and then log back in and be able to look at our medications instantly. So I'm out of here, and I'm going to go back to Medicare.gov, and then I've got it saved here in my system. So we go right into where you enter your medications. We're going to enter the same zip code here just like you did before. We're going to find plans, and like we did before, no, or bottom selection on both the first two, and then yes here. So then we continue on. Drug ID list. We know what that is here. We don't need to go over here and re-enter our medications. We did this today. So we're going to retrieve our drug list. And I'm going to show you how to do one more thing here. Okay, my drug list is complete. I mean, you could add some medications here at this point if you've just been prescribed something. So we can change our pharmacies here if we like. Okay, continue to plan results. And we want to look at the Medicare Advantage plans that include drug coverage. Okay, this is where we're at. And from this point, you may want to compare healthcare costs. So, as well. So what I'm going to do is I'm going to select 3 popular ones. An HMO POS means basically point of service means you don't need referrals. Not always, but usually. So let's look at the HAP. And so from this point, we're going to compare plans. Remember, we're looking at 2018 right now. And I'm going to show you how to compare stuff. So we're seeing a side-by-side here from the 3 plans, okay? And I would go, if you want to look at health benefits right there, an overview will tell you how it's ranked, that kind of thing, what the monthly premium is. And you can see right here, the plan premium on this is $63. It's more expensive than these two. They allot $20 of that to the health plan coverage, $42 for the drug. To me, if you're spending $42 to get a good drug plan, it should be more cost effective than one where you're spending nothing. But in this case, it's not. So here's a good quick look at stuff. I wouldn't get too boggled down with this. This is stuff you can add, the dental, and talk to me about that too, because I don't particularly recommend the dental plans that are built in or that you can add on. Not a good bang for the buck as doing it as a standalone plan. So here we're looking at the costs, okay? Now this monthly premium just includes what they've allotted to for the health, okay, because we're just comparing health benefits here, but they'll talk about a deductibles here, maximum out of pocket, which is really important. And this again is higher. You're paying more for some of these plans. You want to keep this down. That's if you had a bad health year. That's the most you would spend. Then they talk about what are the hospital costs. Those are done right in here, okay? Days 1 through 7, $250 a day. $225 a day for 1 through 6 is obviously less. I'm going to view more. This will give you more comparisons of the different costs. Now, if you get interested in the plan, I'll obviously give you more involved information on that plan. You'll get the enrollment kit and A to Z, everything you'll need that's required by Medicare, but gives you a good look at you know, different costs on the various plans. One of the things you want to look at is preventative dental, see which plans have it and which don't. Some have it. So you can see that this plan has it, these two don't, but this is improving for next year. This plan in 2019 is going to have some dental, even though it's a zero premium. Optional supplemental benefits, I would stay away from buying those. If you're looking for real dental insurance, I'll give you some information on real dental insurance. Optional benefits. Now, when they talk about comprehensive dental, it's not covered. You would add that. So that's things like root canals, so forth. And there's not always a lot of vision coverage, but medical conditions for the eye are always covered. It's just the annual preventative exam that may or may not be covered, or glasses may or may not be covered. You'll usually pay more in a plan for that to get that. So if you're looking for dental, if that's a concern of you, if you've got bad teeth like me, dental insurance might make sense. But I'm going to end the video now. I hope I've given you some information on how to shop for what drugs will cost on a Medicare Advantage plan and how to analyze you know, the different health costs as well. So this is a nice way for you to learn what's best for you and spend some time with it, and then you can help your friends. So this is Larry Belts. If you're interested in enrolling or changing Medicare Advantage plans, get in touch.